Thank you for having me here. I am presenting on behalf of Project 6, which was looking at developing indicators to model the potential human health outcomes of urban transport and urban planning decisions. Professor Newman, Peter Newman, who's the project lead, was also supposed to speak, but unfortunately he was suddenly delayed. And so what I've done, I've broken protocol a little bit and I've merged our presentations into one, hopefully seamlessly, but forgive me if there's a bit of jumbling around, and I hope I can do his presentation justice. I know I don't have his charisma, but we'll try. Okay, so while health impact assessment has been developed, well developed in other fields and used quite well in other fields, its application to date within urban planning and transport planning has been very limited. Urban and transport planning decisions are currently modelled for very tangible outcomes, such things like greenhouse gas output, vehicle emissions, pollution, developments are modelled for electricity and water usage, but how can we include human health in these models? So this project was looking at ways to quantify human health indicators within these models to create a more holistic assessment framework, looking first at how active transport is impacted by urban form and transport decisions, and then secondly, looking at how we can make a simple, effective and consistent measurement that can be added into these existing models, applicable at a precinct scale and applicable to an Australian planning context, but also to elsewhere. So the relationship between mobility and human health is now the subject of significant amount of research around the world. You only have to do a quick Google search and you can find a lot of the impacts on human form, on health from urban form, excuse me. Particularly looking at how mobility choices are shaped by urban form and how these choices are to impact on health. The negative effects of urban sprawl and automobile dependence are now widely accepted, with current trends illustrating that environmental and social limits are being reached. Of particular concern is that car-dependent urban forms, which are prolific in Australian cities since World War II, have led to the creation of obesogenic environments, in addition to increasing heat and transport-related air pollution. It is now commonly accepted that the conventional model for residential development in greenfield sites have led to poor accessibility, low connectivity, and then also growing evidence links these to obesity and other chronic illnesses. Australia, as I'm sure most of you know in this room now, has one of the highest obesity rates in the world, with more than 60% of the adult population in 2012 being overweight or obese. 1/3 of Australians adults are physically inactive. The direct and indirect costs to the economy of obesity, associated diseases, and particularly including productivity loss, was estimated to be about $58 billion, with residents living in cities generally more physically active than those outside of cities. So the National Physical Activity Guidelines for Australia recommends that people should engage in 30 minutes of physical activity over 5 days of the week to be considered sufficiently active, or sufficiently physically active. And this could easily be met by increasing active transport as a mode of transport and also through incidental exercise through walking and cycling. So around the world, we're seeing some really interesting trends. Mode choices are changing towards walking and cycling and public transport as people adopt more sustainable lifestyles and choose locations that reduce car dependence. So this graph shows a number of countries around the world looking at private car and light truck passenger kilometres. And what you can see at about 2004 is there's an interesting decline, and this is happening like I said, around the world. But what's really interesting is that this is happening in the United States, which is one of the most car-dependent nations in the world. And particularly in the United States, this is mostly noticeable in the younger age groups. From 2001 to 2009, car use by 16 to 34-year-olds decreased by 23%. So it is still going up in some of the other age brackets. So you can see on the bottom is age, going up the top is vehicle miles travelled, and the different colours represent the years. So the blue is 1995, the purple is 2001, and the red is 2009. So you can see, particularly looking at the younger age brackets, that car use is going down, while in the older age brackets it is still increasing, but they're declining in use. So this is being linked to new forms of freedom. So the idea of freedom has traditionally been associated with being able to drive, being able to go out and visit your friends, get to your jobs, etc. But with changing technology and also changing lifestyle choices, freedom is now increasingly being offered in other ways, such as through mobile technologies, being able to ride the bus and use your iPad or iPhone, being able to ride the train and use that. So that discourages personal car use, where technically you're not allowed to do that. So Australia is following this trend. This is private per capita travel by city. And you can see, again, around the 2004 mark of private car use per kilometre going down. And this is also happening with rail use increasing, so it's coinciding with that, particularly more towards about the 2007 mark, and in some cities quite dramatically, such as Perth and Melbourne. So rail is being rapidly implemented around the world, particularly in the Asian countries. 82 Chinese cities are building metros and high-speed rail between cities. 14 Indian cities are building metros, and the cities of the Middle East are building metros for the first time, which is really interesting. Probably the most dramatic example of this is the Shanghai Metro. It carries 8 million passengers per day, has 12 lines, and covers 80% of the metro area within a 400-metre catchment of the station. And this has largely been built in the last decade, so this is astronomical. Building on top of things like public transport, walking and cycling, which is where the focus of my research is in, is or what we call active transport, so that is walking or cycling to and from work or public transport, is the most important part of every city. It's not only the face we show the world, the human dimension of cities, it's how people understand cities and how visitors relate to our cities. And cities are increasingly competing with each other on their walking and cycling infrastructure. You only have to look at the changes in New York, and does everybody recognise this site, Broadway, Times Square, and the rapid changes that have been happening there to see this human dimension and why it is so important. However, importantly, walking and cycling are the healthiest ways to get around the city, both for human and for environmental health. Along with the health benefits, the other direct and indirect benefits of active transport are well known and numerous, including decongestion, noise reduction, air quality improvements, and reduced greenhouse gas emissions, along with being an equitable transport mode and also this economic competitiveness that I touched on before. However, I think it's also important when we're trying to develop indicators for this that we acknowledge that pedestrians and cyclists can also be exposed to high levels of air pollution in certain microenvironments, particularly in dense urban environments, and also the risk of accidents. So we looked at what are the urban elements and urban transport elements that impact on health. I'll briefly introduce a few and then I'll talk into a bit more detail on a few of them. So from the literature, the urban form structures that relate to or indicate the potential for increased physical activity and health are compactness and density of urban form, mixed land use, access to public transport, the permeability of the urban environment and also the connectivity and the location of appropriate infrastructure, so the location of footpaths, cycleways, etc. Access to green space and to public space is really important. The amount of time spent in a car, or what we call vehicle kilometres travelled, VKT, and also perceptions of safety, perceptions and also exposure to air, transport-related air pollution, noise pollution, and also accident levels. So these features all overlap and work in ways that aren't completely yet understood, and that makes modelling them really hard, or modelling how they impact on human health really hard. What's also really important to acknowledge is that when we're looking at climate change, is that there's a lot of overlap between active transport policies and climate change mitigation policies. People living in dense urban centres can emit about half the amount of greenhouse gases than those living in suburban areas. And the policies to reduce greenhouse gas emissions often have human health benefits, which great synergies, but also enable us some room to create some of these overlaps and connections between different disciplines. So the policies suggested to reduce greenhouse gas emissions often also have health benefits, including increasing mass transport and access, discouraging car use, reducing trip lengths through mixed-use zoning and compact urban forms, supporting non-motorised modes through traffic calming and bike lanes, and reducing the heat island effect. So I'll briefly highlight some of the findings and measures of these indicators, but many more are detailed on the publications that are available on the website. So people that live in higher density mixed-use neighbourhoods have lower rates of obesity and less chronic medical problems and more likely to walk than those that live in lower density residential areas. However, this is mixed and it depends on what sort of walking and cycling you're looking at. If you're looking at walking and cycling for transport, yes, but if you're looking at recreational walking and cycling, then not so much. And it's important to note that higher density only relates to increased transport walking if it's connecting destinations, if you're able to get to different parts of the place. And low density does, however, usually result in less active travel as distances and times require a car for most needs. Accessible destinations are particularly important, as I touched on before, and especially local grocery stores. Residents with at least one grocery store in the neighbourhood is associated with 1.5 times more likelihood of getting sufficient physical activity. And each additional store is then associated with a 11% reduction in the likelihood of obesity. So when we're planning our urban environments, it's really important that we take notice of where can people get their milk and their bread, or run out and get the paper on a Sunday. Do we create environments where people have to drive to do these, or can we create environments where they get incidental exercise while they can get these? So the link between mixed land use and physical activity has been established. Mixed land use results in more social contacts, not necessarily more closer social contacts, but definitely more social contacts. So if we're looking at mental health, that becomes particularly important. And as I touched on before, walking for transport and walking for leisure have different land use mix that we need to take into account. There's a strong link between car use and obesity levels. An analysis conducted in the city of Atlanta in the US determined that each hour spent in car per day was associated with an increase in the 6% in the likelihood of obesity, and that each additional kilometre walked per day was associated with an almost 5% reduction in the likelihood of obesity. And the relationship between obesity and active travel is inverse, meaning that countries that have high levels of active travel, such as the Netherlands or Denmark, have low levels of obesity. And countries such as ours and the US that have that have lower levels of active transport have high levels of obesity. For our research, the link between active transport and public transport was particularly important, with the modes being integrated and complementary. Most people that use public transport have exercise on either end, either walking or cycling to it. And so transit users have been found to be more physically active than those that drive and less likely to be obese. A systematic review of the relationship between walking and transit found that the transit use was associated with a median of 15 minutes additional walking per day compared to those who don't utilise public transport. And this is not accounting for the substitution of recreational activity, which is really hard to account for in these studies. Importantly, residents need to live near public transport to use them. So along with the built environment elements, there's also strong financial incentives to include potential health savings in the appraisal of transport and urban development, along with the traditional costs associated with infrastructure and transport, what these models do measure. Active transport can have economic as well as social and health benefits. Copenhagen, which has very high levels of cycling, about 33% in the metro area, compared to about Perth, where I'm based, which is about 1.3% in the metro area, found that for each kilometre conducted by bicycle within the city, it effectively gives the city 25 US cents in health and road maintenance savings. And every kilometre driven effectively costs the city 16 cents. So this doesn't sound like a lot, but when you combine it by the total population, these can really add up. Similar research has been conducted in an Australian context. Queensland Department of Transport and Main Roads conducted a study looking at the net health benefits minus injury of walking and cycling, determined that walking had a net health benefit of $1.44 per kilometre and cycling about 75 cents per kilometre. However, for our, active transport, as I said, has economic as well as social and health benefits. This is an interesting one. The Times Square closure and cycle lanes that I touched on before in New York found that there was a 71% increase in revenue. So this is not just about the health impacts, but it can have a broader economic impact. However, for our research, there is limited research on the health cost or benefits of transport and urban form decisions, which are impacted by these models. So this is partly due to the complexity of the relationships involved. These type of calculations require many assumptions which are really hard to quantify, and I'll touch on some of those later. So we used the infrastructure calculations and a cost of illness approach by placing a value on an hour of moderate intensity activity per person. And this was done looking at the Australian average weekly earnings as a baseline of productivity, adult Australians, the number of adult Australians living in a dwelling, 30 minutes of moderate physical activity per day, and that people living in more walkable neighbourhoods have 19% more walking and 21% more of walking trips. So from this, the estimated cost savings benefit from physical activity was $3.24 per hour of physical activity. So there's a few ways that these findings could be used to model the potential health impacts of urban form and transport decisions. As part of this project, we conducted a comparison between a low walkability urban environment, which is based on a conventional low density greenfield suburban development, and a high walkability urban environment with mixed use and a transit core of 1,000 dwellings and a 50-year lifespan to determine the monetary value possibly associated with different kinds of urban form and associated lifestyles, looking at potential health and productivity costs and to see if these could then potentially be modelled to see what the economic differences are. So I don't expect you to be able to read this chart, but it is, as I said, in the papers on the cluster's website. So the chart first provides a summary of transport and land use characteristics and then provides infrastructure costs, transportation costs, greenhouse gas emission costs, and health costs. All of the assumptions behind these figures are in the paper, and they're based on the infrastructure costing work by Trubka, who's part of my research team. So basically what the comparison essentially shows is that infrastructure costs, such as regional power, water, sewerage, and transportation costs, particularly transportation congestion costs, are large and they dominate. The greenhouse gas emission costs are essentially small, except however they are cumulative and they'll become very important in the future. The health costs, if we're just looking at health costs related to sickness, are quite small, but if we include health costs and productivity, then they become quite huge. Productivity has been found to increase by 6% with urban form geared towards active transport modes due to the enhanced physical and mental well-being from walking. Together, all of these costs would provide a powerful and economic rationale to developing urban form geared towards active travel. So the costings we use there are quite generalised, using factors of 19% more people would achieve minimum activity levels in a high-density environment, high-density walkable environment compared to a low-density walkable environment, and then the estimated saving benefits of physical activity. So we then use these and applied these to two different scenarios, one in Macquarie Park in Sydney and one in Perth. I will briefly present the Perth scenario, but the Macquarie Park one is online. So this is Perth, if nobody knows where it is. So the scenario was looking at where we could house the next 30 years of residential growth in a low carbon manner. And so the scenario compares transit-oriented developments along a ring rail line supplemented by a network of light rail and bus rapid transit to a traditional car-based suburban scenario. So the map's showing here, the dark blue or the thicker blue line is the ring rail line. So this is a non-existent rail line. This is a scenario that we developed. And it's the work of Cole Hendrigan, a PhD student at CUSP and also part of this team. The light blue lines are light rail, the green are feeder bus routes, and then the red are the potential redevelopment per parcels. So all of this is within the existing urban footprint. And from this, we calculated the greenhouse gas emissions, the potential vehicle use, and the potential health outcomes for both scenarios. So this is a schematic of how it fits, and I don't know if I know how. So this would lost Perth. There's downtown Perth or Fremantle where I'm based, so the ring rail line goes around, connecting to the airport, following an old freight line for the most part. So it was built, these are some of the Conditions we use 8 to 10 floors on nodes along the rail corridor. If built at the 8 to 10 floor ratio, it would give you 123% of the infill target, which from our Directions 2031, which is our state planning document. It would reduce sprawl. It would house the next 30 years of population and also 50 years of commercial office space. And so, as I said, we looked at the greenhouse gas emissions, the health and productivity values, and transport use. So the Todd scenario would save an estimated $3.9 billion in residential infrastructure costs, 1.14 tonnes of greenhouse gas per year, and $2.6 billion in transportation costs over 50 years. The health and productivity costs, determined following the methodology I showed before, are about $403 million a year due to increases in physical activity, and particularly increases in productivity, which is the red bar. So these are first cut figures as they use generalised factors for all Australian cities. The problem with this method for certain planning models would be, however, that it only assumes two different types of development, a high density walkable environment and a low density low density car dependent environment. And that's not what we're generally dealing with, and not generally what, when we're looking at developments and modelling developments, that's not what we're dealing with. So it can be useful in approximating an idea of health costs. However, it's not much use for precincts or subdivisions, which are the daily activity of urban planning assessments. So how can we use this within a land use development model, such as precincts, Leeds or Green Star? So we were looking at the precincts model, which is developed by Kinesis. Some of you may be familiar with it, and it models developments on the average business as usual scenario, best case scenarios, looking at greenhouse gas, transport, energy, water use, and affordability. So we explored two methods to be able to input or get a human health outcome from these. The first one was looking at the transport outcomes, vehicle kilometres travelled, and public transport mode share. So both of these are detailed in the paper if you'd like more information on how we did it. So as I said before, it's really important to notice when we're doing, or to acknowledge when we're doing this, and think about the different assumptions. There are so many assumptions that need to go into these models, and also how can we deal with it, and what are we comfortable with assuming. So it's important to note that they would all require assumptions, no matter what method you use, about the relationship between active transport health outcomes, land use and transport modes, and also about how the value of health outcomes or health benefits can be applied to transport outcomes. It is also important to note that direct associations between lower levels of obesity and urban form and transport are really complex, particularly due to activity substitution, where transport physical activity takes the place of recreational physical activity. So maybe if they're walking more for transport, there actually could be less physically active because they're not now doing their recreational physical activity. And so these issues are really hard to account for. So to test the two different methods using the transport outcomes from the Kinesis model, we looked at the Cockburn Coast, which is just south of Fremantle CBD, is up here, so Perth would be way over there. It's a new development of 10,000 people, 6,800 jobs, and from the land use model, it produced a best case scenario a business as usual scenario based on bus and car, and a best case scenario based on light rail, bus, car use, and also reduced parking. So these are the outcomes of the model. So you can see the transport of the best case scenario is better. So we took the outcomes of this, which were vehicle kilometres travelled. Business as usual would give you 16 vehicle kilometres travelled per person per day, and the scenario would give you 12. And also the public mode share, which business as usual is 0.1, and the scenario is about 14.8. So using the two methods shown earlier, the two tests seem to be almost identical in their predicted outcomes of potential human health benefits. The VK model determined that 463,000 per year in health benefits and avoided costs for the 10,000 people development, and the mode share model resulted in 434,000 per year for the 10,000 people development, despite the methods being quite different. But again, I think it's important to think about the assumptions that we've put in there. So the health benefits and economic benefits of walkable, transit-oriented or urban form have been well established and are measurable. Of particular importance is the transportation use, using the kind of transport outcomes that can be generated from a typical urban development assessment model, such as VKT and mode share. A methodology that is effective and consistent was created using two different approaches. Although requiring numerous assumptions, the results were virtually identical and the methods were simple and inputs readily accessible. It seems that there is a clear way forward for including transport-related health benefits in urban planning and policy assessments. More broadly, adding these health benefits into the everyday urban and transport planning modelling that we do would make it possible to develop a more holistic economic sustainability and health rationales for adapting our cities to climate change, and would enable urban planners and transport planners to have the best tools to achieve this. Thank you. Sorry, I would just like to acknowledge my research team. As I said, we have quite a big team, and I'd also like to acknowledge CSIRO for the cluster work. Thank you.
Thank you, Annie, and we've got time for just a couple of questions before we break for lunch. Now, the left wing always seems to do better than the right wing for some reason. We've got two questions up here immediately and one here.
Well, thanks very much, Annie. A lot of information there. One thing that you didn't cover very much was something that is happening a lot in European cities, and that's a reduction in speed limits, particularly in residential areas. In speed limits.
Oh yes, yeah.
So in Europe, 30 kilometres an hour. In England, 20 miles per hour. Can you tell us anything about what you know about the potential for reducing speed limits in residential areas in Australian cities in terms of increasing people's physical activity?
I can't speak for all of Australia. In Perth, we're definitely trying to do that, to reduce local residential streets that are designated as active transport streets, bike-friendly streets, those sorts of things, routes to school to down to 30 kilometres an hour. There's a lot of research around about, if you hit at certain speeds, what can happen to that. So trying to acknowledge that, but it's really, really hard to get those things through some of the different levels of government, should I say, yeah, and some of the established transport planning systems. Did that answer your question? I'm sorry, I may have gone off track. I haven't looked at that specifically. Some of the anecdotal evidence that I've seen is that, obviously having streets that are perceived as safer would encourage things like children cycling to school, walking to school, and speed of traffic has a huge impact on that. So I think that would be a really interesting project to look at and to get that through.
Heather Booth, Australian National University. I just want to add to this issue here that the population is ageing, and whilst we try and stay healthy as long as possible, we do eventually become somewhat immobile.
Yes.
What part in all of this planning is anyone taking account of tricycles and quads and things for older people, and parking of these things, because you may need the vehicle to get you to the shops, and then you need to park.
That isn't the focus of my research, but I think it's really, really important, and a lot of bicycle infrastructure in particular can be used by some of those modes, and also increasing the mix of our land use in residential areas so that we have a diversity of housing, those local shops, so people can age in their community, that they know how to get around, they know how to get to the shop, they know, they're still familiar with their neighbours, etc. To alleviate some of those issues is really important. Yeah.
Obviously another issue for the Commonwealth Department of Health and Ageing.
Yes.
Right next to you, Ellie.
We already have a road network that reaches every home, yet in Canberra we're spending $288 million on upgrading one road. Our footpath network only reaches 70% of homes in Canberra, and I suspect it's not much different in the rest of Australia.
No.
We are spending money on walking and cycling. It's being spent in town centres for people who have already found their way into the town centre somehow, and $12 million is being spent on a cycle path on Majura Road, which nobody will use because it's so far away. I'd like to be able to argue that if we spent money on putting another 10% of homes within easy reach of footpaths, that would give us some benefits. Is there any research that quantifies how much putting in a footpath affects local travel?
Yes, there's a lot of research about the provision of infrastructure and how that impacts the use of walking and cycling. There's some really great resources I can forward you, and I'd be happy to if you would like them. I didn't touch on it in this talk just because of the focus of it, but we do have a number of projects looking at how to retrofit some of those areas with, that may not have the infrastructure that they need, such as cycle paths, even footpaths, as you said, in some of the divisions, and how we can make those more sustainable and easier for people to access what they need. So
I think we have one last question down here.
Given that public transport is improving, are we likely to develop significantly more energy efficient cars in the future, or will most of us move to public transport in Australia?
There's room in our system for all different transport modes. At the moment, because we are so dependent on just one mode, it's important to enhance and enable people to have access to those other modes, such as public transport, walking and cycling. But I'm not advocating that we ever become completely, don't have a car share whatsoever. But yes, cars are definitely becoming more environmentally efficient, I guess.
Okay, well, we'll draw that to a close. Firstly, thank Annie for her presentation.